Okay, in this video I'm going to run you through the different parts of various bones and bone markings on the human skull. So I'm going to start with the frontal bone. Frontal bone forms the majority of our forehead. Okay, it's a singular bone. It forms a good portion of the top of the eye socket, what we call the orbit. Forms our forehead, as I just mentioned, and a pretty good portion of the top of our skull. Okay, as you can kind of see as I pull my video camera over the top there. Okay, really kind of just a few general features of the frontal bone. Just right above our nose is the glabella. This is kind of a smooth part just above the roof of the nose. On both sides, on the frontal bone, on both eyes, you'll find, and it's not going to be visible in this bone here, but you'll find two sinuses, kind of squarish shaped, but those are the frontal sinuses. And then you have the supraorbital foramen, which can be tiny little holes that are going to basically be right about there and there. And this model's not exactly the best, but the supraorbital foramens or foramina are sitting right above the orbits, hence the name supraorbital. Okay. So we move back on the forehead and into the top of the skull. We can see the two parietal bones. This is the right one, there's the left one. And the parietal bones are important. They kind of form, like I said, pretty good part of the roof of our cranium. But they also kind of form a good majority of the walls. They also connect by way of sutures to several other of the bones. So there are kind of four major sutures, and those include this long one here that runs from front to back and unites the two parietal bones. We call that the sagittal suture. Okay, suture that sits on top, that is between the frontal bone and then the two parietal bones, is called the coronal suture. Okay, if we move back and I lift up the skull a little bit here, you can see there is a suture that runs across that separates the parietal bones from the occipital bone. That's called the lambdoid suture. You can see it there. And then if I look from the side here, you can see the parietal bones again, and then this is called the temporal bone. We'll talk about that in a second. But you'll see kind of S-shaped suture, which is called the squamous suture. Now, not super prominent on this model are some temporal lines. You can kind of maybe see those there. That's actually where the temporalis muscle will attach. And that's one of the major muscles that actually allows us to move our lower jaw and to chew. Okay. Now, since I'm right here, I'm going to go ahead and start talking about the temporal bone. Temporal bone, you can see, is this bone here. Has quite a bit of features to it, and such. It actually has kind of four different regions. The first region is the squamous part, forms kind of our temporal region, and we can kind of think of it like right there. Here would be our ear, and so it's kind of just above and in front of our ear. Okay, so the squamous part includes the zygomatic process, which is basically what this little kind of bridge is right here. Okay, and that's actually going to unite with the zygomatic bone, which is what forms our cheek, and we'll talk about the temporal process of the zygomatic bone when we get to the zygomatic bone in a little bit. Okay, so you have the zygomatic process, okay, and then if you move back towards where the ear would be, you can see that there's this little kind of notch taken out of the zygomatic process, and that, sorry, fingers in the way, this little kind of depression right here fits this little kind of ball-shaped structure of the mandible, and that bone is or that connection, I should say, is going to form what we call the temporomandibular joint, which is what allows your jaw to hinge. If we move just posterior to that, you can see there's this little hole where my pencil is kind of stuck in right there. It's called the external auditory or acoustic meatus, which is basically your ear canal. Okay, just inferior to that is the styloid process. Very important kind of little hook-like structure that allows for muscles of the tongue, the pharynx, and hyoid bone to connect. Right in behind our earlobe, where our earlobe would be kind of right in here, you can see this little bump. It's called the mastoid process. You can actually feel that externally if you feel right in behind your ear. And that's going to be where a major muscle that runs from kind of the chest up through our neck and attaches to our head will attach, called the sternocleidomastoid. If we take off the top of the skull, we will expose another part. Sorry. Okay. Another part of the kind of base of the temporal bone, because the temporal bone kind of cups the base of the brain. So you can kind of see some of those features, which include the carotid foramen and the jugular foramen. You're going to find those on both sides, which looking are going to be here and here, these two holes right there and there. Okay, the jugular foramen is the posterior one, carotid is in front. Again, yeah, so that is the gist of the temporal bone. Okay. I kind of look again at the back. Let me set this down just a second. Sorry about that. We have the back of the skull now, where we can see the occipital bone. Occipital bone, it actually forms a good portion of the base or the floor of our cranial cavity. The biggest thing you can take away and see right away is this really big hole. We call that the foramen magnum, which literally means a kind of basically big hole. On both sides of the foramen magnum, where I'm rubbing my thumb there and there, are these two kind of little rounded knobs, which we call the occipital condyles. That's actually where the skull rests on our first vertebrae, the atlas. If we move up, you can find this little bump, and this bump can be felt really easily on the back of our skull. That's called the external occipital protuberance. It's an attachment site for a ligament that binds the skull to the vertebral column. Okay, and then on kind of both sides, you'll be able to find some nuchal lines, which also provide attachment for muscles of the neck, which you can kind of see those there and there. Here would be the superiors, there would be the inferiors. Okay. All right, probably the most difficult bone to kind of appreciate, especially when you have a model that's not color-coded like this one, is the sphenoid bone. Sphenoid bone kind of is going to be right in here, but it's actually best visualized by taking the skull apart and removing the top of the skull. Okay, the sphenoid bone is a very important cranial floor bone, and it forms connections with a lot of the bones that we've already talked about, and another couple bones that we'll talk about in just a little bit. Okay, it kind of has this general kind of outline, as I'm kind of using my pencil to show where it is. It has kind of a butterfly shape. Actually has some greater and lesser wings. As far as what I'm worried about you knowing is kind of this little region right here. I'm actually can stick my finger in it. We call that the sella turcica, which means Turkish saddle. That's where a structure dangling from the brain actually rests. That structure would be our pituitary gland. And then you can't see it in this model, but there is actually a sphenoid sinus located, and probably is going to be just inferior to that sella turcica. Okay. The ethmoid bone is another bone that's kind of difficult to really appreciate, but it forms a couple portions of our nasal cavity and parts of our orbit. Okay, the ethmoid bone kind of forms a T-like structure. So if you think of a capital T, the vertical bar of our T actually forms what we call our nasal septum, at least part of our nasal septum. Okay, that vertical bar is called the perpendicular plate. Okay, the horizontal bar of the T forms kind of the bridge of our nasal cavity, so it kind of sits like my pencil does there. Okay. One of the key features extending off of that cribriform plate is this kind of little rhinoceros horn structure called the crista galli. Okay. It's what helps divide a series of olfactory foramina, which are little holes extending or to allow for the olfactory nerve to send neurons down into the nasal cavity. And then some final structures that are not going to be visible on here, but are a series of little kind of air pockets, tiny little openings within the ethmoid that we call ethmoid air cells, or just ethmoidal cells, where they open up into the nasal cavity and act like sinuses, just like the frontal sinuses and the sphenoid sinus that we just talked about. While I'm looking directly into the nasal cavity, the last structure that I want to talk about of the ethmoid bone is the medial nasal conchae. Okay, you can see the medial nasal conchae. You cannot see the superior nasal conchae, and you can see the inferior nasal conchae. These are kind of just some projections projecting into the middle of the nasal cavity from the lateral walls that help to kind of speed up, warm, moisten air flowing in through our nose as it comes into our pharynx. The inferior nasal conchae, each of those are actually separate bones, whereas the superior, which is you can't see, and the middle are their parts of the ethmoid. Okay. While I'm also looking in here, the inferior third or so of our nasal septum, and you can kind of see right there where I'm holding, that is called the vomer bone, and it sticks forward kind of from inside and actually attaches to the sphenoid, and it runs forward. And many times when somebody has a broken nose, they actually have damage to the nasal septum. You may have heard of a deviated septum. That's kind of what we're talking about, where it's deviated off to one side. Okay. Now those make up the parts of the cranial bones. Outside of the inferior nasal conchae, the vomer, the rest of those were all cranial bones. Now, looking at the face, we can kind of talk about some of the other facial bones. So the first two bones I want to talk about are these two bones here that form our upper jaw. Those are our maxillae, okay, or maxilla for singular. Okay. First thing I want to kind of point out, just below your eye sockets, you can see two very distinct openings. Those are the infraorbital foramina. Okay, we talked about the supraorbital foramens up here. These are the infraorbital foramens down here. Okay. Now, something unique to the maxillae and the mandible is the presence of teeth and sockets inside of those bones where our adult teeth come down and push out our child teeth, as we can kind of call them, when we lose our teeth and grow up through childhood. Each little projection between our teeth is called an alveolar process. We have them both in our upper jaw and our lower jaw, and each actual socket where the teeth are found are going to be called alveoli. Singular would be an alveolus. And that's kind of going to be found, like I said, in both the maxillae and the singular lower jaw, our mandible. Okay. Our palatine bones are going to be best seen on the inside, and I guess I can just show you from here. on the inside and forming the roof of our mouth, they only form about the back third, whereas the anterior 2/3 were actually going to be formed by the maxillae. So those are going to form what we call our hard palate. Okay. Already talked about the vomer. That's another facial bone. Moving towards the side of our face, we have our zygomatic bones. Zygomatic bones kind of form the bases of our cheeks. They also kind of form the inferior and lateral walls of our orbits. Okay. As I mentioned earlier, they connect with the temporal bone at this kind of suture here. The little projection connecting to that part of our temporal bone is called the zygomatic process, or excuse me, the temporal process. The zygomatic process of the temporal bone is where the temporal bone connected. Okay. Our lacrimal bones are going to be two very small bones on each medial side of our orbit, kind of right on the medial side of our eyes. One key feature of our lacrimal bones is this kind of depression here, which is our lacrimal fossa. Okay, it holds our lacrimal sac, which is what collects tears from the eye and actually allows them to drain into our nasal cavity. And that's why our nose will run when we tear up. Okay? And the last bone, or excuse me, not the last bone, but the last bone right in this general region are your two nasal bones, which kind of form the bridge of your nose. Now the very last bone of the face is our strong and biggest and only movable bone of the face, which is our mandible. Mandible has quite a few features. Right away you can kind of see a singular hole, another singular hole over here. Those are both found in our chin. Those are what we call mental foramina. We already talked about the alveoli and the alveolar processes. There's actually kind of three different distinct regions to our mandible. The body is kind of where our chin is. The angle is going to be where the mandible takes kind of an angle as it starts to move towards that temporal bone that we talked about, and we call that part up here the ramus. Okay. Now the actual little knob that articulates with the temporal bone is called a condylar process, or just a mandibular condyle. Okay. You might notice in front of it, or anterior to it, is kind of a little hook-like structure. We call those cornoid processes, and you're going to have those on both sides, just like you're going to have the condyles on both sides. Okay. The cornoid process is important. It allows for attachment of that temporalis muscle that I kind of talked about a little bit ago. Okay. And then the very final structure is going to be found on the inside of the mandible, which are going to be two more foramens, which we call the mandibular foramens. So that really should kind of wrap up the skull. So if you enjoyed it, thanks.